Welcome back. A common treatment for low testosterone is testosterone replacement therapy. Dr. Hendrickson is still with us to talk about the risks and benefits of this treatment option. Thanks for staying with us, Doctor.
You're welcome.
So, if tests determine someone has low T, one treatment option is testosterone replacement therapy. But what does that entail?
Well, lately, because it's becoming more of an issue and there's more demand for replacement, pharmaceutical companies have come up with a variety of ways to obtain the testosterone in your system. They've got skin patches, which can be applied once a day. They've got gel that comes in packets and pumps, and those come on once a day. Mouth patches, injections, implants. So there's a variety of ways that this can be applied. The one that's been out the longest is the injections, and that can be done even by someone in your home about once every 2 weeks on average. The other ones are usually once a day.
So there isn't just a simple pill you can take?
Well, there are pills, but most people have shied away from those. There's some evidence that that may be harmful, some concern it may actually cause cancers and other liver problems, because the way it's absorbed goes directly into the bloodstream and is metabolized through the liver, as opposed to the other ones that go through the skin or get absorbed into the system in a different fashion. So we try and avoid the pills.
So I want to talk about some of the possible negative effects of replacement therapy, but let's first talk about the benefits. So what are a few benefits?
Well, I think besides noticing that the sex drive improves and the ability to get an erection can improve, and usually does shortly after beginning, men will notice that their energy and enthusiasm in general can improve. Bone density takes a lot longer to develop where the bones become thicker. Muscle mass can change, especially if they're working with resistive exercises such as weights. If you don't exercise, you don't notice the muscle mass as much. Weight loss can occur if you work on losing the weight. You can't just take the testosterone and expect the weight to come off. And mood improvements can also occur. So a lot of times we'll have men who are significantly depressed, we're having a trouble getting that better, check their testosterone level, find it's low, start them on testosterone, and it helps in the treatment of their depression.
So those are the benefits. Now let's talk about some of the risks. So what are some of those risks?
Well, if you're applying the patches or the gels, etc., you can get rashes and itching and irritation. The testosterone itself can actually cause acne-type breakouts in men because it mimics kind of the effects of what happens at puberty in men when they get acne. It can enlarge the prostate, so you can have more difficulty with urination. If they're not sure that it causes prostate cancer, but if you have an early prostate cancer, there's a belief that the testosterone can make the prostate cancer really take off and grow much quicker. If someone has sleep apnea and it's not being treated, it can make the sleep apnea worse. Because it affects the red blood cells and the blood system, it can make people more susceptible to forming blood clots. And because testosterone can be metabolized into estrogen, if you get too much testosterone, or in some men who are sensitive to it, it can be cause men to get enlarged breasts, but that's a very small number.
So what about heart attacks and strokes? Can you speak to those risks?
That is a concern, and we watch for those, and we try and explain that to people that there's a risk. We know that men are at more risk for those than women, and obviously that's related to the male hormones to a certain extent. It's hard to quantify how much that increase risks. To a certain extent, that's one reason why some physicians are a little bit reluctant to prescribe testosterone to men. They feel that the risks may exceed the benefits.
So with all those risks, and it does sound like there are a few of them for sure, how does a man know that he's a good candidate for this replacement therapy?
I think they need to talk it over with their physician, and the physician can share their recommendations based on the individual's risks versus potential benefits. People who have certain risks probably should not take testosterone. But I think that's so individual, it should be discussed with their individual physician.
So if someone decides to go for the replacement therapy, is this something that they have to do the rest of their life?
Yes. If you're going to take it, you probably need to take it ongoing forever, because the reason you started in the first place is because your body was not making enough, and your body will not start making enough at some point in time down the road. You're supplementing what your body doesn't make enough of.
So overall, what is your professional opinion about replacement therapy, and would you encourage it for appropriate patients?
Overall, I feel that for a significant number of men, replacement therapy is worth a try. Because injections are not acceptable to a lot of men, they choose not to use the injections, and the cost of the other modes of testosterone is high. That a lot of times will keep people from using it. Other people get side effects, they choose not to use it. But I think the benefits for a large population far exceed the risks.
Thank you so much. We need to take another break, but coming up, are there natural ways to boost your testosterone levels? We'll find out right after this. Don't go away.